me to do a video on the procedure that I'm doing for hand grafting. So I will run the video and I will give you the explanation about how I do it and why I do it like that.
That would be the full screen.
I don't know how to do it. No, I don't need a sound. It's just you should put it on full screen.
No, it cannot be. That's the full screen.
Yeah, okay.
That will be the full screen.
Okay. Okay, so this is a patient of mine which came to me for fat grafting, and I've done a hand augmentation previously 7 months ago with some HAs, but now because she was asking for some fat grafting into the face, we decided to do some grafting in the hand as well. And as you can see here, when you do fat grafting in the hands, you can treat those depressions that you can see between the vessels and between the tendons, but you never achieve any results in terms of spots, aging spots that we have. So those spots can be treated with other types of techniques like lasers. I sometimes do nanofat on the dorsal side of the hand because this being a conglomerate of growth factors, stem cells, and stromal-vascular fracture, it's going to enhance the beauty of the skin. This is how I do the markings. You can do it either from distal to proximal, like I'm showing here. I usually do this when I'm using a HA, because when I'm using fat, I usually go from distal to proximal. It's very important to crisscross, as you know, in every area where we do fat grafting or hyaluronic acid. It's good to crisscross every time because you have a good spread of the product or of the fat in the area that you want to deliver. And this is how I'm doing my harvesting technique. I've shown you 2 days ago in the fat grafting session how I do that. I'm infiltrating the patient. This is the belly of the patient, which I'm infiltrating with a multiple hole cannula. Then I'm waiting for 25 minutes, and then I'm changing from this infiltration cannula with this tulip cannula. It's a 2.4 millimeter cannula. It's the one that I use to prepare my microfat. This is the cannula that Alex Verpalen and Mark were describing when they wrote about microfat and nanofat. Then I'm aspirating the fat with a syringe, as you can see here, and this is my fat graft. I usually do it in the hand with microfat. This is how I prepare it, and now, as you probably know, there is a new system, a closed system to do this, but you can still do it like this. It works very fine. I'm just washing the fat, as you see here. I have that piece of textile that is called organza. And I can remove everything that I don't need so that in the end I have a good quality fat, a good yellow quality fat that I can inject into the hands. As you can see here, I'm removing the oil from that what I've prepared so that I can have the fat as pure as possible for the moment that I'm injecting it into the hands, and to avoid any nodules and granulomas that you can get if you have a lot of things that are not fat in there. And this is how it works. Then I'm putting everything in a syringe. I usually collect it in a 20 milliliter syringe, as you can see here. It's pretty basic. It's not very scientific, but it works very well. And as I told you, now there is this closed system, and a very interesting thing, you have it here. I have no financial interest in any firms that are exposing here outside. It's just that I bought a set here as well, because the set for the closed technique for preparing microfat costs $1,200 in Tulip, and here it's $350. So for those of you who are interested to do this technique, you can buy it here 4 times less. This is how I prepare nanofat. I'm just showing this for the purpose of education because I'm not going to do it in this hand, but usually if you want to enhance also and you have small wrinkles on the hand, on the dorsal side of the hand, you can also use this nanofat because it's enhancing, it's beautifying the skin as well. I'm using the same piece of organza here. I'm emulsifying the fat until I get this yellowish, whitish liquid, and then I'm just squeezing the piece of organza and I will get my nanofat. As I was showing you 2 days ago, nanofat means that you don't have any adipocytes there. You just have stromal vascular fraction and growth factors. So you don't have to be afraid to inject it very superficially. This is the best way. Don't be afraid when you see those small blebs on the skin, and they stay usually until 24 hours after the procedure. Just talk to your patient, tell them that this is how it will be, and then they will understand and you will have a good result. This is how I do it when I do fat. A big advantage of fat is, as I was telling you a few minutes ago, usually we try to crisscross everything that we are putting so that we have a good spread and an even spread of the products. In the case of the dorsal part of the hand, you have that lamina that Sebastian was talking about, which is a good plane there. And when you put your fat, you can put it from one point only. Of course, you can start it from proximal, from distal to proximal as well. But I usually do it this way. And you can see I'm a very important thing. I don't do any anesthesia in the hand. I'm just anesthetizing the entry point, and that's all, because patients are not complaining that much about pain. So you can do it in a pretty quiet environment. A very important thing, when you inject it, you constantly have to spread it with your hands, and this is a good anatomic plane for the fat to be spread pretty evenly. And as you can see, I'm transferring from the 20 ml syringe to my 1 ml syringe. One very important thing here is to use a bigger diameter cannula, because you have those vessels on the dorsal part of the hand, and you try to stay away from puncturing them. So the best way to do that is using a bigger cannula. The bigger the cannula, the more roundish the tip. So the risk of entering into a vessel is very, very small. So this is a 1.8 millimeter cannula which I'm using for this purpose. Of course, with this one you can use also a bigger syringe, a 3 milliliter syringe, for example. It's very important to adapt the diameter of the cylinder of the syringe to the diameter of the cannula. You know, when you have, for example, a very small, a very thin cannula and a bigger syringe, it's very hard to push, and it's advisable to have a control over the things that you are doing. So every time adapt. Never use a 10 ml syringe with a 29 gauge needle, because you don't want to harm the patient, and because the needle is thinner and it doesn't hurt. No, that's not okay, because you're going to have problems injecting the liquid because of the different pressure between those two diameters. So I'm moving to the other hand here, and as you can see, I can do the procedure pretty smooth. I'm just making a incision. I don't cut anything. I'm just using a 18 gauge needle to make my puncture there, and then I'm going in with my cannula and spreading the fat evenly. Because of this anatomic area, you can have the benefit of not needing to crisscross everything, because you can spread it nicely by simply massaging it. I usually pay attention to the commissures, because this is the area where you have those depressions, and I'm injecting as much as I can. Very important, at the end you will see this is a patient where I've injected around 8 ml on each side, but you can go from 5 to 25 It's very important in the dorsal part of the hand not to overcorrect, because when you do that, you won't be able to remove it anymore. You cannot do a liposuction in this area because of the vessels that you have, and there is no hyaluronidase that you can use with that. So be very careful not to overcorrect. And this is how it looks. I spread it evenly, and you will have a better result after 2 weeks, after 1 month. So you don't have to expect it immediately. You have to tell the patient. And even if some vessels remain visible, it's okay. It's all going to be beautiful after around 2 weeks, 1 month. Thank you very much.